Good day, it's Dr. Daniel Cameron. I'm here with another All Things Lyme blog. The question today, how much does Lyme disease cost society? The title, Lyme disease can cost billions. The cost of Lyme disease is high. If we look at 2000 at a journal article by Zhang called Economic Impact of Lyme Disease in Emerging Infectious Diseases, they looked at cost data in 5 counties of Maryland Eastern Shore. They looked at clinical findings, tick exposure, and other clinical details. They were able to show the mean cost for each Lyme disease patient was 1,310 degrees for early Lyme and 16,199 annual costs for chronic late Lyme disease. Now, these patients weren't really being treated. That's why most of the cost was the productivity cost, non-medical cost, where people are often not working. The high cost of chronic and late Lyme is higher than for other chronic conditions. It's higher than for rheumatoid arthritis, fibromyalgia, and lupus. Chronic and late Lyme is common after a 3-week course of doxycycline for a rash. This is from an article by Alcott in Quality of Life Research in 2013, where he looked at post-treatment Lyme disease syndrome. So rather than treat, he elected to follow them up over time. He found that 36% suffered from post-treatment Lyme disease syndrome within 6 months. So at 6 months, 36% of the patients reported new onset fatigue, 20% widespread pain, and 45% neurocognitive difficulties. The patients who developed post-treatment Lyme disease syndrome had significantly lower life functioning compared to those without post-treatment Lyme disease syndrome. Dr. Zhang, in that paper, relying on CDC numbers, which was 23,763 cases, estimated that the nationwide annual economic impact of Lyme disease and relevant complaints was $203 million in 2002 dollars. Zhang postulated the cost of Lyme disease would rise if the case number rose above 23,000. They estimated that there are 300,000 plus cases in 2016 in the U.S. So the cost for society would add up to $2 billion for a year if we extrapolate the costs described by Zhang to patients with post-treatment Lyme disease syndrome. So let's do the math. The number of early and chronic late cases in 2015 would have been 192,000 early cases and 108,000 late cases. The cost of Lyme for each individual was $1,310 for early and $16,199 for late. The cost of Lyme disease society, if you do the numbers, would have been $251 million for early and $1.75 billion for chronic and late Lyme, for a total cost of $2 billion each year in the U.S. Zhang warned of costs beyond the study period. Costs that were not considered included any costs incurred beyond the study period. And this is a particular concern if we look at a paper by Wetzner, Wissentainer, and Wormser in the journal Diagnostic Microbiology and Infectious Diseases. There he found that if he followed people who treated after a rash and after a positive culture for Lyme, and if you follow them for 11 to 20 years, he found that 11% suffered from post-treatment Lyme disease syndromes. And these patients are patients who had significantly lower life functioning compared to those without post-treatment Lyme disease syndromes. None of these patients would be counted in the cost study. If we look at the pain and suffering, Zhang warned that his cost did not include pain and suffering. So if you were sick for 11 to 20 years after a diagnosis with post-treatment Lyme disease syndrome, that wouldn't be counted. Lastly, how much does Lyme disease cost society? The answer is quite a lot, both to the individual and society. Such high costs undoubtedly supports the urgent need for more effective treatment regimens than a single 2 to 3 week course of antibiotics Watchful waiting is a risky and costly strategy in dealing with Lyme disease epidemic. Thank you for joining us on Dr. Cameron's All Things Lyme Facebook and blog.